Good morning. We're here with Professor Wang. Very nice to see you here. Thank you for being here. We would like to start by making a few questions. So first of all, are you enjoying the Congress? Do you like the structure, the topics? Are you missing anything?
No, I think this is my second time being here in this Ticare conference, and I enjoy it. There's a huge crowd, and also the content is very good. So far, I've been sit through it, and they even talk about how to save the tooth instead of placing an implant, which is unique. They're open-minded, and they're trying to include all the current advanced science into their conference, which is very unique.
Nice to know. Thank you. If you had to choose just one, what is the major future challenge facing implantology nowadays?
I think the major challenge facing implant today is a peri-implantitis. Everybody knows that. And the difficulty is how to properly treat it. So a lot of people starting now focus on prevention. And I think the key to prevent the peri-implantitis is put the implant where they're supposed to be with a good, I always said a 6-dimensional position, buccolingually, apicocoronally, mesiodistally. Think about you doing an immediate implant or not, because you have to think about the bone remodeling. You also need to look into the angulation, which is a prosthesis. Eventually, that's going to impact on how patient maintain, what kind of occlusion you're going to build it up. And certainly, it's very important today is the soft tissue phenotype considerations. You have to look into 2 millimeter keratinized mucosa and 2 millimeter of the tissue thickness. And that's always good for implant long-term stability and to avoid the peri-implantitis. And other factors like the patients, which they have a certain disease, like smokers, diabetics, and also certain other risk indicators should be considered before you place the implant. If you can do that, you can pretty much avoid the peri-implantitis.
Sure.
And learn how to properly manage it.
Yeah, proper plan, proper execution, and the proper follow-up by the patient as well.
Yeah.
Okay, thank you. What would you consider vitally important for long-term success in implant treatment? Although I think that you have already replied to this question.
Yeah, I think what I just mentioned for the implant long-term success or stability, we got to look into all the factors I just mentioned, implant 60, patient's risk factors, and also the site, we call the risk indicators, and you have to think about all that. Beyond that, you also need to think about the implant, maybe some things like a Ticare, zero gap concept, so there's no micropia, there's less micro movement, and that's one thing that's very unique on the implant fixtures, can certainly help to prevent a certain peri-implantitis. Other things very important is you have to have a patient come back with the regular maintenance. Patient cannot just go away. They need to be part of the team and continue to maintain, continue to be clean, and so that can be a long-term stability.
Absolutely. Right, so you are a little bit ahead of my questions with the gap zero and the micro leakage. So according to recent data, almost 1/4 of placed implants are at risk of failure due to peri-implantitis. Do you think the absence of bacterial microleakage between the abutment and the implant could help reduce peri-implantitis?
Yes, as I mentioned to you in the last comments, the zero gap concept is very important, especially on the bone level implants. Because when you place the bone level implant, you have to place below the bone. And when you place below the bone, there's a micro gap. There's a potential micro movement. Any gap, any movement is going to trigger the bacterial accumulations. And that leakage can cause a peri-implantitis, which becomes one of the major challenging issues. And I think that's one thing with the zero gap concept, you can avoid that.
Right, great. So on a scale from 1 to 10, how would you rate a hybrid implant, speaking of the peri-implantitis, for maintaining proper peri-implant health? The hybrid one with the smooth surface on the top.
I think the perio hybrid implants on the Ticare is a similar, and it's like what I always say. I like to see the polished color on the crestal portion with 1.5 millimeter will allow either bone formation or connective tissue attachment if they get exposed. So you can certainly prevent of a future peri-implantitis. because you shift the micro gap all the way to below the crest or above the crest. So the chance for them to get the microbiology invasion is less, and also you can encourage either bone formation or of soft tissue thickness. Both are equally important to maintain the tissue stability.
That's
so
right.
I think that's one thing I like, because I like to see 1.5 millimeter of that kind of a hybrid polished color, and together with your implant crown, whatever, and you can polish 1.5 millimeter for their ceramic, so it allows the junctional epithelium to adhere.
Nice. So you rate it in an more than an 8, maybe?
Yeah. Yes.
Great, thank you. And last question. Since our last Congress in 2024, it seems that AI is here to stay. So far, what do you think it has been AI's greatest contribution to the dental sector?
I think artificial intelligence, AI, is here to stay. As I involved in a lot of the study on the AI, I think particularly on the treatment plan, diagnosis, and also practice management. I think that's already been developed. But in the diagnosis, in the treatment suggestion or treatment plan based upon clinical scenario, you can actually get out very nice data. For example, if I took the histology, I can send it to AI. They can identify disease much quicker than the human eye can.
That's right.
And they can give you the disease right away, and they can propose the treatment approach. And so a clinician can actually adapt much quicker. And the similar things for periimplantitis, similar things on periodontitis. They can look at an X-ray available and chart available, and also other factors they consider. Then they can classify the disease for you. So I think it's here to stay, and I don't think they are not going to replace the dentist, because there's still the hand, you still need to treat it. But some people kind of worry about it. They think about you can create a robot to do the treatment. Maybe, but that's maybe about 20, 30 years down the road, not right now.
Not now. Now it's a tool. It's just a helping hand.
Yeah.
Right.
Yeah.
So, okay, thank you so much.
You're
You've
welcome.
been great. Thank you for this interview and for all the information.
Thank you.